about pain in general and particularly pain due to spinal injuries like herniations, for example. Is that anything that interests you? Because I can talk about a million subjects, and since it's just you, you can do whatever you want.
That's true. That is interesting to me. So I would like to hear about that.
Okay, excellent. So I'm going to get back to the screen share that you just saw me futz around with. I want to show you first just a model of the spine in general. How much do you know of general anatomy?
I took an anatomy class, so.
Okay, that's great.
I know
so
some.
You know that what we're looking at here on the right side, the big parts are the vertebrae, so these are the bones. And in between, like this light yellow, these are the discs of the spine. You see it in this image from the side, a little bit clearer. And those, where are we? Sorry about that. Okay. And those discs in the spaces between the bones, they provide a lot of different functions. They provide some cushioning, as you probably learned in anatomy class. They also just help the joints articulate, meaning the movement in the spine. And they also just give us a little bit of shock absorbance. So for example, when you're running and jumping, you can imagine easily that every impact would end up right in the brain if it wasn't for a little bit of shock absorbance. So we get that through the discs, but also you can see through this normal curvature of the spine. And so we talk usually about having a bit of lordosis in the lower back, which means this kind of sway where you see that there's curvature here. Then we have kyphosis in the upper back. So these curves also create this effect where, you know, the bouncing can be taken partially from the curvatures of the spine. So that's why sometimes you might hear chiropractors say, okay, this is really bad, your neck is way too straight. And then they're trying to correct that, sometimes with adjustments, sometimes also with like special pillows and stuff like that. All of those things in the last 15 years have been researched a lot more, and we found out that actually there were a bunch of misconceptions, and some of those ideas about how the spine should be aligned have been proven not to be really true. Mostly because we've been noticing that there's so much variance between different people, and particularly the alignment of the spine in relationship to what kind of possible problems we could have later on, that has not been confirmed. So they've done tests on tens of thousands of people where they would look, okay, how many of these people have any back pain, and how many people of those have any kinds of misalignment problems, excessive curvature or no curvature at all, or curvature in the wrong direction. And if it's just a little bit of less curvature, or if it is no curvature at all, they actually found that there is no relationship to more or less pain. So the people who have these misalignments have pretty much the same incidence of pain as people who have textbook perfect curvatures.
Wow.
So that's an interesting tidbit, and we've seen similar results for other things. I personally work in alignment in general. In Germany, I'm licensed as a naturopathic physician. In the US, I just have a massage license in order to be able to touch people, but I also have special certifications in alignment-based exercises, and then in Rolfing, which is all about helping people with posture and movement. And we used to be the ones who are trying to say, okay, if our body is not perfectly aligned, then we can get into all these long-term problems. And so a lot of our own assumptions have been really challenged. So we had to just change a bunch of ideas. And for me, that's fascinating because in my opinion, it's not the purpose of science to give you straight answers. It's pretty much the purpose to ask more intelligent questions. So I always find it interesting. And I find that a lot of the reasons that our treatments work, same thing why treatments of chiropractors work, are not the ones that we assumed they would be. So that doesn't mean it doesn't work. It's just that the background behind it is a little bit different than what we were assuming. Everything makes sense so far? Did I ramble off too far anywhere? Okay, cool. Interrupt me, ask questions if something doesn't make sense. It's kind of cool that it's just you and me, so we can just have a conversation. So far, what did you find the most interesting?
I would say what you just said about medicine always changing. Sorry, I don't know how to turn my text off.
Oh, don't worry about it. As long as it's not my phone, I'm not worried about it.
But what you just said about how it's different for each person and how some people will have the textbook perfect spine and then they still have problems. So that's really interesting because I have scoliosis. So I always wonder how that will affect me, if it'll actually, if I'll have those problems, or if with yoga and chiropractic and things like that, if I'll be able to maybe even reverse it. Not completely, but a little bit.
Yeah, that's great. And I've worked a lot with clients with scoliosis actually. And so I find that very rewarding. I also have looked into a bunch of the research on scoliosis. So
what do you think as far as how, I know the research isn't really there as far as how people get it and what causes it, but do you have any theories?
Yes. So,
what are your theories?
And I mean, this is a thing that is almost like a mistake that our brains make. We are always trying to find one reason for a problem. And I think I found the best analogy in trying to predict the weather, because there are so many contributing factors that it's really hard to say, okay, this is what caused the hurricane.
Gotcha.
So with symptoms in the body, and particularly pain, there are so many potential reasons. And usually what we have in order to have any type of a symptom, and you can say the degree of curvature in your spine is a symptom, there's usually a bunch of different factors that led to that. Because if it's just one thing, the body just compensates for it. The body's really good at compensating for things. But all that being said, and taking into consideration that I know what my brain wants to do is find one thing, and there's a lot of different things. One thing that I have found often in people with scoliosis is that it starts manifesting when they're like between 10 and 14, and usually it starts showing up when they really go through a growth spurt. And that got me thinking, because I've also noticed that when I'm working with kids of that age who have growing pains, so the parents might bring them in saying like, he's always saying his legs are hurting so bad. And that led me to notice that the different tissues in the body don't grow at the same speed. So you might have a growth spurt, and what grows most is your bones, but the ligaments and the fascia and other firm tissues are not growing at the same speed. So then you're pretty much being held back by the soft tissues while the bones keep stacking up. And so, of course, I noticed that first when I was with the kids with the legs, where it was really obvious, they just grow 2 inches and all the muscles are suddenly too short. So they would have normal flexibility before, but then suddenly, just bending forward doesn't work anymore. And, they're not able to even touch their knees anymore because the hamstrings are so tight. Which mechanically makes sense. If you imagine this is like the big thigh bone, and these are the hamstrings on it, and then suddenly this bone gets much longer, but the hamstrings don't grow at the same speed. Of course, they're tighter. So then I was thinking about the scoliosis cases, because of all the very firm ligaments around the spine that hold one vertebra to the next that's stacked on top of it in place. And I want to see if I can get back to a model that makes a little bit more sense. Yeah, we can actually look at an MRI right away. So if you look, this here is an example of a herniated disc. So where that red arrow is, that is where you see the disc material is pushing into the spinal canal. The spinal canal is where the big nerves are running in the spine before they branch out into all the different parts of the body. And you see like the herniation is pushing in here. But what I'm talking right now about is like, if you have one vertebra and then here's the other vertebra, here are the discs in between. All around are very firm ligaments whose job it really is to make sure that the bones stay in place, and that if you have a lot of impact, they don't just get displaced one against the other. So it's really easy to imagine that when you have a growth spurt and these bones grow faster than the ligaments, it has to go in some direction. And a lot of the scoliosis that I see is that most of the curvature is kind of in the mid-back. So it's like around this area. And then we have added on complications by the attachments of the diaphragm, and then attachments, the higher up attachments of the big hip flexor muscle, they actually attach right on the spine. So if you look at this here, if you see my mouse moving, so the big hip flexor muscle attaches right onto the vertebra in here. So if that is too short relative to the spine, there's a lot of pull from there. Then there's pull from the diaphragm attachments. Then there's pull from all the ligaments around the spine. And so you can imagine that if the bones grow, this can be just displaced sideways because it has to go somewhere, and there's so much pull on it from different directions. So often when I've been treating teenagers and young adults, I found that the most reduction of curvature I see in 15 to 25-year-olds. Past 25, there's just so much that has already been compensated for over years and years and years that things don't change so fast anymore. They do still change. It's just that we don't see so much reduction in curvature so easily. So that's kind of my theory and what I find. There are some hereditary factors that some people who had really bad scoliosis also have parents or other relatives, but sometimes it shows up with like no good reason at all. And I always try to ask about these growth spurts, and I find a relationship there. So all that being said, what I do in treatment is just loosen up all the attachments to the spine where I can reach them. Meaning to get to the hip flexors, you can even work through the belly to directly get all the way to the spine, which sounds a little crazy, but if you look at this image, you see that this here is the whole belly, and these vertebrae, they come forward quite far. So we always imagine like the spine is just these knobs in the back because that's where we feel it. But if you look at the belly here, you just take a deep breath out, and this comes already so far back, and then you need only a little bit of push to really get to the muscles that attach here in front. So I often find that there comes some relief from doing these treatments. Higher up, you have diaphragm attachments. And then, of course, there is a lot, and I find the most is not the manual work where I work on the body, but where people do targeted exercises. Yoga is really great, particularly when there is a lot of education on alignment, and if you can encourage the instructors to help you out. So you can really just start doing small rotations with your own body. And I often teach clients to do that in front of the mirror to really check, okay, where are the ribs coming forward the most? Because that's where you see it the easiest, how the curve goes. And then you can just do these little nudges and pretty much straighten it out yourself and use the small muscles in the spine to even out some of the curvature. Pilates is really great too, just because there's so much emphasis on the core. But while we're talking about all this theoretically, I'd love to know right from you, how much curvature do you really have? Do you know the degrees?
I think it's 23.
Mm-hmm.
It's a C shaped, and it's like where you said in my stomach area.
Mm-hmm. Okay. So 23 degrees is seen as kind of mild to moderate.
Mm-hmm.
Usually when it's over 45, then they say, okay, this is where we really should do surgery because otherwise there's too much pressure on inner organs, particularly The lungs are often influenced, or even the kidneys, because they're close to the spine. In your case, there is a lot that you can work with, even if you don't manage to correct the curvature, but you can get more mobility into the joints of the spine. And I always have to almost laugh when I'm taking exercise classes and you're doing these things where you're like in a forward fold, and then they're telling you to come up one vertebra after the other.
Mm-hmm.
But how are you going to know whether this is one vertebra after the other? So I love to teach people to do this against the wall. So you can stand just like 1 foot length away from a wall and push your back against the wall, bending the knees a little bit. And then you really feel, okay, it's this bit, it's this bit, it's this bit. In the beginning, it's going to be super hard because you notice that you're moving like a whole block of vertebrae away from the wall and to the wall. But little by little, you can learn to just do like one joint after the other. And because you push against the wall, you will feel, oh, okay, this was like a huge thing. I have to work on this a little more, a little more, a little more. Now we have like something else that I find fascinating, because the brain, the motoric center in the brain that pretty much controls all the movement, has maps of the body to know, okay, this is this part, this is that part, this is how we can move this. If you use the body in a way that doesn't use all the joints, your brain thinks there are no joints. My favorite example is feet, because you probably heard there are people who can do crazy things with their feet, like painting or stuff like that, if they don't have hands. But most of us, I mean, we walk around like we just have these lumps down there. And if we're doing exercises and people tell us like, well, okay, try to only lift your big toe and leave all the others down, it feels totally impossible. And that's because your brain maps it out as if it's all one thing. So you can lift all the toes or put them all down. But if you're really doing exercises like that, and for a while I was doing all that because I pretty much built my own arches because they were collapsed, after about 2 weeks, the brain starts realizing, oh, okay, there's actually a differentiation. And you can do the same thing with the spine. It's just hard to get through the frustration. It's similar, like when you're building new muscles, you have to kind of deplete and exhaust it in order to be built more. All that makes sense?
Yes.
Okay.
Following along.
It's the same thing with neural connections. And I'm sure you've noticed that when you were studying really hard subjects, or for me, learning another language, it gets so exhausting to do everything in a different connection and having to think in patterns that are new to you, because the brain has to build really new connections between the different nerves. And it's trying not to do that because we're always trying to conserve energy. And so it gets to this edge where you feel like you're really frustrated. So if you're doing like these wall exercises and you feel like, I'm not getting it, this is not moving, that's exactly where your brain needs to be in order to build these new connections. So try it out for about 2 weeks. And really, it's enough to just do it a minute at a time and play around with it. And if you have a mirror, that's also good to just play around with how can you turn your rib cage in order to try to get a little bit more symmetry. Don't drive yourself nuts and maybe overcorrect a little bit and just play with it. But if you're doing it every day and ideally several times a day, the brain is going to adapt and say, oh, okay, we need this. We need a lot more detailed information, and then you'll get it. I find with most people with scoliosis, the most important thing is really to get mobility into all the small joints, because then you learn to stack your spine the way you want it. What usually happens when we're doing any type of exercise that is like big movements, we're training all the big superficial muscles. So then you have like one long muscle that goes down all your back. When you're doing these detailed things, you're engaging the small muscles that are really from one vertebra to the next, or from 1 to 2 up. And then there's also those ones that kind of cross over. So they go from the back of 1 to like the sideways process of 2 up. And those help with small rotations. If you're doing exercises like that and you start feeling pain and soreness, that is because you're using muscles that you haven't used before.
Okay.
Actually, it's going to be a good sign. It's like when you've been doing like a lot of squats and your butt hurts like crazy, same thing. And now I want to go back to the herniations that we started talking about, because we used to think that a herniated disc is like a terrible thing, and you're pretty much doomed to having this pressure on the nerves coming from the herniation. Oh no, this is not the right. Well, there's a few bulging discs and there's a herniated one. Yeah, okay. So right here, so you see this is really pushing into the spinal canal. Up here, you see like it's getting close, but it's not like this complete rupture of the disc. What usually ruptures is like the thing inside the disc. It's called the nucleus pulposus. So the disc itself is like a ring of fibrous cartilage, and then inside there's like this jelly stuff that helps with the shock absorbance. If that really comes out, then they call it a true herniation. But the part that is often overlooked is that, like any other injury, this is going to heal. It's difficult injuries in connective tissues, so it usually takes a few months. But if we're doing MRIs before or right after an accident, and then we're doing them months later, in most cases, the bulge goes away by itself because the body takes care of things if it just has enough movement. So that led to a complete change in how these things are being treated. Because in the past, like when I remember 20 years ago, when I was going to college, it already was shifting. 40, 50 years ago, they still used to say, okay, you have to just lie flat on your back and not move for 6 weeks. Now we know this is completely wrong, because in order for things to heal, you need blood flow. And the nerves particularly, they always need to be able to just move a little bit in their own connective tissue sheaths in order to heal. So the more movement we do, the better these healing processes can work. And what I also found really interesting was that they did, just because MRIs started becoming more and more cheap. When I was going to college, an MRI was still like a super expensive thing. So you would only do it in an emergency, and then you wouldn't do it again. So you had this idea of permanence, like the disc is destroyed, this is the way it is. And then people walk around with this image in their head. Okay, this is my bad disc. Uh-oh, I gotta be careful. And what we know now, because the MRIs are so cheap, that these things really changed a lot. And then they did an interesting thing. They did on athletes, competitive athletes, just like in general, because it became more affordable, just like screenings with MRIs. And they were shocked to find those people who are really like at the peak of performance, super healthy, no pain. They found a lot of herniations that were old and were already healed. And those people said, I don't remember, I never had any back pain. So that really caused us to think differently about these things too. What were you gonna say?
Oh no, that was just cool.
Yeah.
I like everything that you're saying. Very interesting.
Okay, cool. Yeah. And so I've been following pain researchers in Australia because I got more and more people who have really difficult cases of chronic pain. And there is an institute in Australia of neurologists who have been really great at researching causes for chronic pain. And they've been finding like it's usually more a disease of the nervous system and problems of how the brain is processing pain than it is a problem of what's actually happening in the tissues. Because typically the tissues are healing. So it's not so much of what's going on in the body part that hurts. It's a lot more what the brain is making out of these signals. And they did really interesting research about, okay, what happens when somebody gets injured and, you know, they do go and get some treatment or they don't get treatment, and how much likelihood do we have of developing chronic pain? And it is usually that 80% heal just fine and around 20% start developing some chronic pain condition. And it doesn't really matter what injury. And they found that in the case of herniated discs, it was pretty much the same thing. few months later, whether they're getting physical therapy or not, whether they're going to the chiropractor or not, people just heal by themselves as long as they're staying active. But the ones who have had a doctor show them a model like this, with like the sticky outy red thing here that is supposed to model the herniated disc, they had a much higher likelihood of developing chronic pain. And they found out that this first conversation with an expert has a much higher influence on how their recovery goes than anything they were doing in the recovery, which is crazy because we always think it all depends on the therapies. But it really turned out that with chronic pain, it depends a lot more on what people are expecting. So that's like mind blowing to me because I'm like, okay, does it all come down to placebo? What's going on here, right? So the Australians actually started forbidding their doctors to use these models because they were saying, like, people get this fixed image in their head of this is the way it is. And they started telling people just, what I usually say. You have an injury, it's going to heal. Just stay mobile, be careful. I like to say with injuries, find a way to work around the pain, not through the pain. You don't want to re-trigger the injury over and over, but you want to keep the blood flow around the nerves. And what I also try to do is to just explain to people that they can teach their brain, like, okay, things are not as dangerous as we think. We shouldn't expect that this is permanent. And people can start really changing their own thought patterns in order to get them out of the chronic pain just by focusing on the things that work well. And that's the reason why particularly strength training has been so successful in treating chronic pain, because the brain gets all these signals, oh, this is working just fine. Oh, I can lift more weight. And then the sense of danger is not so high. And there's more like, oh, okay, actually things are moving fine. And then the pain gets lowered. Because we have learned that pain itself is not really a signal that comes from the nerves out of the periphery. So out of the periphery, when I get injured, when I have like a scrape here or something too hot, out of the periphery, the signal is just, there is potential danger on this arm. Check this out. And the brain then interprets of how many of these danger signals are coming in, how much do I feel like I'm in a safe situation? Have I had anything like that happen before? And so all of those things lead to a modulation of the pain signal. So the more people feel like they're in a safe space, they know this thing that has happened before, and they don't feel that much pain. And that is a great explanation for this thing that sometimes happens to me. Like I'm changing, I'm undressing, I'm in front of the mirror, I see this huge bruise on my thigh. What the hell happened? I don't remember anything. And what I think probably happened was like, I ran into the edge of the table, but because it happened a lot of times, it doesn't even register. This is not dangerous. I'm just at home. This happens all the time. But in the tissue, there is still this bruise, but the brain doesn't even register it because, we're totally fine.
That's so interesting.
Yeah. They find it amazing. And that's also an explanation for why people are able to, if they're good about being hypnotized, to just go through surgeries or things like that without feeling pain. So that's really interesting too. What I find the tricky part is how to talk to clients about it, because what I notice in a lot of colleagues is they get all fascinated with this and they start talking about it. But to the client or patient, it always sounds like, oh, this is just in your head. Oh, you're just making this up. Oh, just don't be so dramatic, and then the pain is going to get better. So the important thing for me is always the pain is actually real. So there really is something going on that we have to take seriously. But we also have to try to tell our brain that, like, hey, things are going to heal. I can still move. I can move this and this and this way, and that will make it better in the long run. And to just focus on this idea of functionality and just use the pain as what it really is. There's a signal of potential danger. So if I move this way and that triggers it, well, I'm probably pushing on the injury, so I better find a way around it. All that makes sense?
Mhm.
I'm talking a ton because these are the things that I'm the most fascinated by. So I was in a car accident a few weeks ago, and I think it was exactly 4 weeks ago. And it was a crazy accident.
Okay.
I actually flipped over. There was like a big metal structure that fell off a truck. And so my
Oh my
car hit
God.
it head on. It flipped over with like the trunk going over and above so that the car landed on the roof and then rolled over and then landed on the wheels. And I got out and I was actually really surprised that I felt fine. And it turned out I have a herniated disc in my neck, and this is the image of my MRI. So you see right here, if this is up there, I think it's not up there. Am I sharing the screen with you right now? No.
Mhm. I can't see it.
Okay. Screen share, go here, go here. Here we go. Now you have it, right? Yeah, okay. So let's just annotate this. There we go. So you see the herniation here,
Oh yeah.
but I don't have any fitting symptoms. And so I went to the orthopedic surgeon who ordered the MRI just because my attorney, I got an attorney because of the complication of who is liable for that thing that fell off.
Right.
She said, you have to get an MRI, you never know. And I'm like, I'm fine, I don't want anything. But the surgeon was really surprised that I have no symptoms, and they did all kinds of neurological tests. And I am convinced it's just because I was so much focused on, oh, I'm fine, I'm okay, this is all right, everything moves just fine, I have full range of motion. And there
Mhm.
is not enough pressure into the spinal canal. So if this would be
Right.
protruding much more, then I probably, whatever I think, I would still get some influence in how the nerves are transmitting signals. But this is enough for the body to compensate. And because I think I'm in good shape, I keep working out, it feels good when I'm working out, I don't really notice anything. But
That's great.
also, I think because I've been reading all that research, so I know a herniated disc doesn't mean that I have to have pain. So it's kind of cool how I am my own best example now.
Mhm.
And I hope that I can
Yourself
get
as a
another
science
MRI.
experiment.
Sorry, say that again?
You're using yourself as a science experiment.
Exactly.
Not on purpose though.
Not on purpose. Nobody should do that. Yeah. So that's been kind of a cool experience. And so I wanted to just make this segment all about the spine and herniations. Was there anything that you didn't understand?
No, that was all awesome. You explained it very well.
Okay, cool. Do some of these exercises because
Yeah,
particularly this rolling up and down the wall is huge
I
in
definitely
helping
will.
you remap your spine because we barely know what's going on in our backs. That was always a big frustration for me in yoga classes that I never know. Do I have a flat back? Am I
Right.
rounding? I have no idea. If nobody's touching me, if I don't see a mirror. So that's really going to help you get more feedback from your brain to know where you are in space.
Thank you so much for that.
Any more questions?
No, that's all. Thank you so much.
Okay, great. Well, thank you so much for joining me here. So I'm not
Thank
standing
you.
alone with my weird construct here in the living room. I have like boxes stacked and extra
Oh,
lamps.
for your tripod. Well, thank you. I hope you have a great day.
Thank you. You as well.
Bye.
Bye bye.